Well, nurse Sandra Lindsay is best known as the first American to get the COVID-19 vaccine. The critical care nurse who was on the front lines of the pandemic became a symbol of hope.
We all saw her image early in those days, but the Jamaican immigrant says becoming the leader that she is today was not an easy journey. It's one of the many stories she talks about in her book, First in Line. It is a G thing.
G Thing, presented by Northwell, who believes when we raise health, we raise everyone. Northwell, raise health.
This is the moment the world was introduced to nurse Sandra Lindsay. She had no idea she would make such an impact.
I did not expect that I would be the first. That's not why I wanted to get vaccinated. I felt it was my civil responsibility.
Now, after 3 decades of nursing, Lindsay is putting it all in writing.
My book, First in Line, comes out July 23rd. I think I have a story to tell that will be inspiring to someone.
That story starts in the island of Jamaica, where she was born and raised.
I always knew I wanted to become a nurse from about age 9. I took care of my grandmother who suffered chronic illnesses. It taught me empathy, compassion, everything that you need to become a nurse.
The journey to fulfill that dream was a struggle.
Coming to America with no scholarships, just a dream of wanting to become a nurse. I had to work hard. I worked 2 and 3 jobs. I worked less than $4 an hour.
The single mother worked and went to school full-time while raising a son in the Bronx. But with hard work, she earned the role of the director of critical care at Northwell's Long Island Jewish Medical Center. Then everything changed.
I remember on March 13th, Friday the 13th, I will never forget, when I had to call a meeting with my critical care team of leaders. And I said, guys, things are heating up here. We're seeing more people being infected and coming into our emergency rooms. We expect that more people are going to be infected because the virus is just spreading like wildfire.
And just 3 days later,
the unit that we had prepared for patients infected with COVID-19, all the rooms were filled. On that day is when the heels came off, scrubs went on.
She was also forced to confront racial inequalities.
It was really heartbreaking to see the disparity, the number of people that look like me, people of color, who are dying disproportionate to other ethnicities. We still have the issue where your zip code really dictates life expectancy.
Today, she's hoping to inspire a new generation of nurses to carry on her legacy.
When I do retire, I think that I will be proud of what I left behind.
What do you think of her?
Well, she's an amazing woman. What I thought is a great question, because as I walked through the hospital, the way people approached her, hugged her, listened to her, cared about her. And we had an exchange at one point where I said, your childhood was robbed because of all the responsibility you had. And she said, no. I learned compassion. I learned thoughtfulness by taking care of my elders, and it prepared me for nursing. And she's more or less like a diplomat now, representing the best of Northwell. Yeah. She was somebody that didn't know this was going to happen. Yeah. They put her right there at the last minute, and she was the perfect person, reacting with the press. Yeah. And she's a private person, and yet she handled the press beautifully, handles her job beautifully. What a gift.
Yeah. And we trust the vaccine. We all trusted the vaccine at the time, but still, it's a bold move to be able to say
in front of the world,
exactly, that I'm going to take this vaccine. You know.
And also a bold move on her part to say the best of me is going to do this, and if it's good enough for me, I want to share it with you.
Right. Well, thanks for sharing her story.